Good evening, or good morning, good afternoon. My name is Irais Hernandez, and I am a community advocate or community outreach specialist with Parkland Community Health Plan. And tonight we have a presentation for you given out by Ms. Shelly Cabrera, who is the program manager for the STI division for Dallas County Health and Human Services. She's got a great presentation here for us tonight. So I'm going to turn it over to her so she can go ahead and, provide us with some very important information.
Thank you so much for that introduction, Ms. Hernandez. I'll be speaking about what our division, the STI HIV division at Dallas County, what we're doing in the community to combat syphilis and HIV, and what our division do. So let's go ahead and proceed to the next slide, please. Now, who we are the division in Dallas County Health and Human Services that receives positive labs from providers, labs, insurance companies, and hospitals for the following notifiable conditions: gonorrhea, chlamydia, syphilis, HIV, and AIDS. Our division has three components to it. We have a surveillance, partner services, and outreach. Surveillance, their role is to review and record and record search positive labs for syphilis and HIV. If they suspect this is a new case, initiate to disease intervention specialist, also known as DIS, for further investigation. This staff also reviews positive labs for babies and initiates to DIS, which specializes in congenital syphilis and perinatal HIV, for further investigation. And we also have what we call HIV surveillance. They're responsible for medical record abstraction for HIV labs. This team requests medical records from providers to collect data such as demographics, risk factors, medications, viral loads, opportunistic infections, so on and so forth. They report these findings via the Adult Case Report Form, which is also known as the ACRF, or the Pediatric Case Report Form, commonly referred to as PCRF. They also conduct provider visits to physicians who do not report timely or isn't responsive to medical record requests. And then we have the partner services component in our division. This is what we call the public health follow-up. These DIS counsel and interview patients who test positive for an STI or suspected to have an STI or HIV. Partner services is conducted in an effort to stop the spread of STIs and HIV in Dallas County. The public health follow-up DIS interview or counsel involves speaking to a patient about their medical history, what's adequate treatment for syphilis, chlamydia, or gonorrhea. They want to know what the patient knows about the infection that they have. So they want to go over the disease comprehension and education. Then we talk about partner elicitation. We want to know, how did you get this infection, and then who have you possibly exposed to this? And we talk about risk factors, risk reduction. And in risk reduction, we're having a conversation about what can we do to reduce your chances of getting this infection again. Okay. We talk about referrals, and we also want to know screening sites. What's a good area in Dallas County for us to go out to conduct outreach? And that outreach involves free testing in the community. This conversation is confidential, and we often ask open-ended questions: who, what, when, where, and how. We also have a congenital syphilis. We have a DIS that specializes in this. And congenital syphilis occurs when syphilis is transmitted from mother to infant during pregnancy and or at delivery. Congenital syphilis can cause serious health problems like miscarriage, stillbirth, premature birth, and or birth defects. Congenital syphilis DIS are responsible for conducting congenital syphilis investigations. In 2022, Dallas County investigated 226 congenital syphilis cases. Of those, 3 were stillborn. And there I have a small picture of what a baby with congenital syphilis looks like, some of those signs and symptoms. With congenital syphilis, we also have what we call the FEMUR. And Texas uses the Fetal Infant Morbidity Review to conduct enhanced reviews of congenital syphilis and perinatal HIV cases in Houston, San Antonio, and Dallas. Missed opportunities for disease intervention in barriers to medical care engagement that may have contributed to congenital syphilis or perinatal HIV diagnoses are identified. These meetings are held quarterly and include, but not limited to, medical providers, members of healthcare systems, the public health sector, representatives from systems who serve persons diagnosed with syphilis or HIV. And the slide says our next meeting is in July. Of course, this is an old presentation, but we do have an upcoming meeting in January of 2024. And another component of our program, is probably the biggest one, is our outreach. This is where we have our medical mobile clinic. We, in collaboration with community-based organizations or CBOs and internal DCHHS divisions, we are deployed to perform education, outreach, and prevention for STIs and HIV in Dallas County. And that's just a picture of one of our medical mobiles. In our outreach, we partner with CBOs that include, but not limited to, Abounding Prosperity, AHF, Parkland, and we also partner with some of our internal divisions here at Dallas County, which is the COVID team, chronic disease, our sexual health clinic, and our PrEP section of the sexual health clinic. And we also partner with our Ending the HIV Epidemic division. In our outreach, we offer free testing for chlamydia, gonorrhea, trichomoniasis, syphilis, and HIV. Each client is provided free condoms along with STI education. And let me say that treatment is free. Next. And I just want to reiterate that it is free. And if you come back positive for anything that is treatable, that treatment is also free if you get treated at the Dallas County Sexual Health Clinic. And some of our outreach numbers, here I have a graph of what we did in 2020, 2021, and 2022. At the bottom of the graph, you see that we total tested. In 2020, we tested 1,251 individuals, 2021, 922, and 2022, 1,553. And in the top portion, in the little bar graph, you're going to see how many actual cases that we identified with our outreach team. In 2022, we identified 43 new cases of syphilis. 2021, we identified 30 new cases. In 2020, 36 cases. HIV, in 2022, we identified 2 new cases. 2021, 7 new cases. 2020, 5 new cases. And our numbers there are also for gonorrhea and chlamydia. Now, you might want to say, well, where are you located at Dallas County? Our division is located on the 1st floor. Our surveillance team is located on the 3rd floor, and I'm the program manager, and my email address is there and my phone number.
Thank you so much, Ms. Shelley, for providing us with some great information about STIs and HIV tonight. It is very important information for us to know and for us to be able to get that word out in our community too. Also, I want to remind you that that you can find this recording and the recording of past webinars that we have had on different topics. You can visit our YouTube link. Our YouTube is Parkland Community Health Plan. There you can view any material that we have already previously recorded. I also want to remind you all that if you are not following or part of our Facebook, that you go ahead and look us up, as well as Parkland Community Health Plan. Please join us, please follow us so that you are staying in the know of what we got going on, what we're doing out in the community, any events, information of when, for example, the Dallas County Community Health Department is out there with free, outreach clinics that they have with their mobile unit, or just any events that we are participating in. Thank you so much again for joining us tonight.